Everyone, welcome to ResearchMD.com. We got a great presentation. Let me introduce myself. My name is Dr. Pramil Cheriyath. I'm the Program Director, Internal Medicine Residency and the Transitional Residency. I teach medical students and residents on a daily basis. I'm also Assistant Professor of Medicine, two large medical schools in the United States, also Director of Research. Okay, today our topic is right here, Paxlovid, okay? Very important drug, or the only oral medication available to treat COVID, and a lot of people are taking it, so it's good to know what's going on with the Paxlovid, okay? Now, Paxlovid is actually a combination of two drugs. The first one is nirmatrelvir, and the other one is ritonavir, okay? Two drugs. They are like protease inhibitors. They can say like antiviral drug. So when you talk about nirmatrelvir, you got C23H32 F3N504. That's the chemical formula if you want to know. And the other drug is called ritonavir, which is C37H48 N6005 and S2. That is the chemical formula for that, okay? So two protease inhibitors, they package together to attack COVID. That's what the medicine all about, okay? Now, let's look at the mechanism of action. What happened in the actual mechanism? We got this infection or the virus, right? SARS-CoV-2. Right? That is an infection that coming to the cell, they attach to this ACE receptor to enter. It's very important to enter into the cell. Once it enters into the cell, you got viral RNA release. Okay, and after that, the polyproteins kind of act on it and they break it down into small particles. Okay, and then there is this 3C-like protease inhibitor breaking down to small particles, and then that kind of leads to viral RNA synthesis and protein synthesis, and a lot of damage can be done, or more variant of the virus can occur. Okay, so you got like viral polypeptide broken down 3C-like proteases. Okay, so what does our drug do? The first drug is nirmatrelvir, right? Nirmatrelvir. Well, it does inhibit this 3C-like protease enzyme. Okay, so it's not broken down to small particles. So inhibit that. And what does the other ritonavir does? Ritonavir does not have a direct action on the COVID-19 virus. Okay. But what does it do? You're just making sure they inhibit the cytochrome P453A and CYP2D6. They inhibit it. When they inhibit it, the concentration of nirmatrelvir in the body, it goes up. So there are more potent effect of nirmatrelvir. So that's what. So it's no direct effect. I want everybody to remember that. Now, let's come up here and let's talk about over here, the dose. Again, we have two drugs. They are like combined in a package, okay? So you got nirmatrelvir 150 mg, 2 tablets you have to take, and the ritonavir 100 mg, you take 1 tablet, okay? Now, you take both of them twice daily, okay? And then you take it for 5 days. Remember that. So 2 drugs, twice daily, take it for 5 days. Now, let's look at the administration. And people always have questions like, should I take it with the food or without food? Does not make any difference. You can take the food with the food or without the food, you can take it, okay? Now, indication. What is the indication for this? This, again, remember, most important, this is only for mild to moderate COVID. If you have severe COVID and you need to go to the hospital, you're hypoxic, this is not the drug. There's like other drugs we can do to treat you, okay? Not for this. For mild to moderate COVID, which you can take medicine by mouth, okay? And then you can use it in the adults. In children, pediatrics, 12 years or older, and if they have like 40 kilogram weight or higher, then you'll be able to use it. Now, again, remember, not recommended for severe COVID, and don't, like, if the symptoms, let's say you had COVID for 5 days, don't start it. There's no indication. You cannot use it, okay? Now, pharmacokinetics, let's see, like, how the drug is broken down in the body. So, nirmatrelvir, the half-life is 6.05 hours, ritonavir is 6.15. Not much difference, okay? The metabolism, elimination, nirmatrelvir is renally excreted. Okay, when you talk about ritonavir, that's hepatic excretion. Why is that important? Because you have to think about like both, when you get renal metabolism, If somebody have renal failure or hepatic failure, it's very important to adjust the dose, okay? So let's look at the contraindication. Anytime when you have any of this hypersensitivity reaction to the drug, you cannot take it. Or previous history of any hypersensitivity reaction to nirmatrelvir and ritonavir, you cannot take it. And then liver disease. I mean, there's this classification. When you have liver disease, child A, child B, child C. That child poo A, B, C. That's a classification we usually use. And A and B, you can use it, but child poo C is a contraindication. That means you cannot use it. And any of this drug, like some of the drug, remember we talk about this role of like CYP3A inducers, inhibitors, and if they're like inhibitors, you have to be very careful, and that's not recommended. So many drugs in that category, okay? Now, main thing everybody's worried about, adverse effect. Like what kind of adverse effect can I have? I mean, if you look at, the metallic test, diarrhea, hypertension, myalgia, those are the common side effects. We did an informal study. We looked at this, there was a website and people were commenting what kind of symptoms they have. And the informal study, did it by ourselves, but again, it's like 50% of the people have a metallic taste, okay? Some people kind of drooling out the secretion in the mouth, and 40% of them say like abdominal cramps, they have diarrhea, and then nausea, vomiting. So it's two major is metallic. Most likely you're going to have metallic taste in the mouth as soon as you start taking it. Some people said even within 30 minutes, and then expect the abdominal cramps, diarrhea, nausea, vomiting also. Now, 5% of the people in that, again, this is an informal study, okay? It's not a scientific study, but people reported 5% have sleep disturbances, and 5% have like a kind of unusual, kind of low heart rate. We call it like bradycardia. So palpitation, some of them kind of reported that. So we don't know how much information about it, but there are no reports about this drug causing like arrhythmia, but I think we need to watch that out. Now, drug interaction is a huge problem, okay? This thing is like, remember, CYP3A metabolism is a lot of drugs come into that category, so they can interact. Mainly, even the statin, anti-anginal, anti-arrhythmic, the most common drug today people take their own statin. That can also cause problems here, okay? And antipsychotic medication cause problem. Viagra, that can cause problems. So be careful. I mean, before you start Paxlovid, check with the pharmacy or check with the doctor and do an interaction check, and you may want to stop the other drugs if you're taking, if you can. Otherwise, don't take it, okay? Very, very important. Now, renal failure, again, we talk about, when you look at this drug, nirmatrelvir is renally excreted, okay? So if that's why before you have to look at the GFR, your kidney function. Mild renal failure is okay, but the GFR is between 30 to 60. You decrease the 150 milligram nirmatrelvir, okay? But that's the only one renally excreted, so you don't have to make any changes in the other dose. Everybody got that? Now, when you talk about the liver disease, first you have to classify your liver disease based on the child poo classification, A, B, and C. A and B, you can continue the dose. C, don't take it, okay? Very bad, like, they can cause your liver completely stop. It's going to be so if the child poo classification, do not use, okay? And now, let's say if you miss the dose, what do? If it is like less than 8 hours, you take the missed dose as soon as possible. Okay, now if it is more than 8 hours, don't worry. You take the next dose as usual. Don't try to compensate for taking an extra drug, okay? So remember, if it is less than 8 hours, you just kind of take the drug and start taking as usual the other drug. But if it is more than 8 hours, don't try to compensate it. You just take the next dose as usual, okay? So let's go back and just summarize. Okay, just a little bit. Let's look at like what's going on up here in a nutshell. We talk about two drugs, protease inhibitors, and then mechanism of action. We talk about the 3C like protease, nirmatrelvir inhibited, and ritonavir. What does it do? It makes the concentration of nirmatrelvir high. Okay, and then the dose again, you use twice daily for 5 days. And again, remember, it's only for mild to moderate disease, not for severe disease. Remember that. Okay, and then pharmacokinetic. Remember about the hepatic and renal metabolism, and then contraindication. Be very careful about hypersensitive reaction. You cannot use it if there's severe liver failure. You cannot use it, and then adverse effect. Expect metallic taste, my friend, in the mouth, abdominal symptoms, diarrhea, nausea, vomiting, very common, and renal failure, decrease the Paxlovid dose, and child puke C classification, do not use. And when you have missed dose, if it is less than 8 hours, you just take the extra dose. If it is more than 8 hours, forget the dose, continue with the other doses, okay? Thank you so much for watching. We'll be back with another presentation soon. Please subscribe to our channel. Thank you very much.